There are many viruses and diseases in the world today that can cause significant harm or even death to the majority of people. Despite the fact that there are treatments for a wide range of illnesses, viruses present a special challenge to medical professionals and researchers since they frequently resist the effects of antibiotics and other traditional treatments. As a result, we've produced a list of the top 10 deadliest viruses on Earth. Before we dig in, please know that we gathered this information from our own research, and we recommend you do a deep dive yourself for any of the viruses we listed for more info. You might be shocked as to what you find, so please watch this video to the end, subscribe to the channel, grab some snacks, and let's go. 10. Ebola Virus. Rare outbreaks of the fatal Ebola virus disease, EVD, mainly affects the African continent. People and non-human primates are the most common species to be affected by EVD, such as monkeys, gorillas, and chimpanzees. It is brought on by an infection with a family of viruses belonging to the genus Ebola virus. In what is now the Democratic Republic of Congo, the Ebola virus was first found in 1976 close to the Ebola River. Since then, the virus has occasionally infected individuals, causing outbreaks in a number of African nations. The virus first infects humans through direct contact with the blood, bodily fluids, and tissues of animals. 9. Marburg Virus. With a fatality rate of up to 88%, Marburg virus disease is a very deadly illness that causes hemorrhagic fever. The virus that causes the Ebola virus sickness is related to this virus. The disease was first identified in 1967 as a result of two significant outbreaks that happened simultaneously in Belgrade, Serbia, Marburg, and Frankfurt, Germany. Once a person has contracted the virus, Marburg can be transmitted by direct contact, through a break in the skin or mucous membranes, with the blood, secretions, organs, or other body fluids of an infected person, as well as by contact with contaminated surfaces and materials. 8. Rabies. Rabies is a zoonotic, viral disease that is preventable through vaccination. But when clinical symptoms start, rabies is almost always fatal. Domestic dogs are to blame for the human rabies virus transmission in up to 99% of instances. Rabies, however, can strike both domestic and wild animals. By bites or scratches, generally through saliva, it is transmitted to both humans and animals. Except for Antarctica, all continents have rabies, with Asia and Africa accounting for more than 95% of all human deaths from the disease. As one of the NTDs, rabies primarily affects underprivileged and vulnerable communities that reside in isolated rural areas. There are rabies immunoglobulins and vaccines for humans, but they are not widely accessible to individuals who require them. 7. Smallpox. The viral infection known as smallpox is dangerous and frequently fatal. It can result in lifelong scarring and is infectious, meaning it spreads from person to person. Disfiguring scars can occasionally result from it. Despite the fact that smallpox has been a problem for humanity for thousands of years, smallpox vaccines allowed for its global eradication by 1980. In the natural environment, it is no longer found. In 1977, smallpox was last confirmed to have occurred spontaneously. Although smallpox vaccinations are effective, routine vaccination is not advised because the majority of people are unlikely to contract the disease naturally. 6. Dengue. A viral illness carried by mosquitoes, dengue has recently spread quickly in all areas. Female mosquitoes, particularly those of the species Aedes aegypti and A.E. albopictus, are the principal carriers of the dengue virus. These mosquitoes are also carriers of the Zika, yellow fever, and chikungunya viruses. A vast range of diseases are brought on by dengue. This can range from mild flu-like symptoms in those who are sick to severe disease. Some people may not even be aware they are infected. Although they are rare, severe dengue can cause a variety of consequences, including severe bleeding, organ damage, and/or plasma leakage. 5. Hantavirus. The hantavirus family of viruses, which are primarily carried by rodents, can cause a wide range of illness symptoms in individuals all over the world. Any hantavirus infection can cause hantavirus illness in humans. The New World hantaviruses are those found in the Americas. This pulmonary syndrome is an uncommon infectious condition that manifests initially as flu-like symptoms before quickly worsening. It may result in heart and lung conditions that are fatal. Another name for the condition is hantavirus cardiopulmonary syndrome. The hantavirus can cause hantavirus pulmonary syndrome in a number of different strains. The deer mouse is North America's most common carrier. Hantaviruses from rodent urine, feces, or saliva that have become airborne are typically what causes infection. 4. MERSCoV. The clinical spectrum of MERSCoV infection varies from no symptoms, asymptomatic, to mild respiratory symptoms to severe acute respiratory illness and death. Fever, coughing, and shortness of breath are classic symptoms of MERS. A severe disease may result in respiratory failure that calls for mechanical ventilation or treatment in an intensive care unit. It appears to be more likely to affect the elderly, those with compromised immune systems, and those with chronic illnesses such as diabetes, hypertension, cancer, chronic lung disease, and kidney disease. 3. SARS-CoV. The coronavirus related to SARS is the virus that causes the respiratory illness known as severe acute respiratory syndrome, SARS. A China-based outbreak that affected 4 additional nations was the cause of its initial identification at the end of February 2003. It spreads in a manner similar to how the common cold and influenza spread. SARS is an airborne virus that can spread through tiny droplets of saliva. It was the first serious and easily transmitted disease to appear in the 21st century, and it manifested a definite capacity to spread along the routes of international air travel. Indirect transmission of SARS can also occur when infected individuals touch surfaces. 2. SARS-CoV-2. The severe acute respiratory syndrome coronavirus 2, SARS-CoV-2, is a highly transmissible and pathogenic coronavirus that first appeared in late 2019 and has since caused a pandemic of acute respiratory disease known as coronavirus disease 2019, COVID-19, which poses a threat to both individual health and public safety. The diverse group of viruses known as coronaviruses can cause mild to severe respiratory infections in people. They affect a wide range of animals. These patients displayed viral pneumonia symptoms such as fever, coughing, and chest pain, as well as dyspnea and bilateral lung infiltration in more severe instances, just like those with SARS and MERS. In December 2019 in Wuhan, China, the first instances were reported. There have been more than 30 million confirmed cases worldwide since then. 1. HIV. The infection known as HIV targets the body's immune system, particularly the CD4 cells, which are white blood cells. A person's resistance to opportunistic infections like tuberculosis and fungal infections, severe bacterial infections, and several malignancies is weakened as a result of HIV's destruction of these CD4 cells. It is transmitted through sharing injection equipment or through direct contact with the bodily fluids of an infected individual, most frequently during unprotected sex, sex without the use of a condom or HIV medication to prevent or treat HIV. HIV can progress to AIDS if it is not treated. Antiretroviral therapy, sometimes known as ART, is fortunately a viable option for HIV treatment. The amount of HIV in the blood, commonly known as the viral load, can be drastically decreased with HIV medication if taken as directed. We hope you enjoyed this video. If you did, please hit that like button, subscribe to the channel, and turn on the bell notification so you won't miss out on our amazing videos. Thanks for watching, and we'll see you in the next one.